Next up, we're going to talk about the quadriceps muscles, which are these big muscles on the front of your thigh, which you probably think of as hip flexors. But their most important job is not that. It's actually to extend the knee. All right? Okay, so quadriceps, as the name implies, 4 points of origin. So this is a 4-part muscle with a common insertion on the quadriceps tendon. The parts are the rectus femoris, which is going to go straight down the femur. And then the other 3 parts are called vastus, because these are really big muscles. Vastus lateralis, vastus medialis, and then the vastus intermedius is between those two, deep to the rectus femoris. All of these insert first on the quadriceps tendon, which engulfs or covers the patella and then becomes the patellar ligament, and then that inserts on the tibial tuberosity on the front of the tibia. Okay, so all of this whole big muscle, all 4 of these muscle parts are going to insert on the tibial tuberosity. So their main job is actually to bring the tibia, toward the thigh. Okay, so they're knee extensors. That's their main job. The rectus femoris is going to help flex the thigh. Okay, so it is a hip flexor. Now, notice when I mentioned the word rectus, that means straight, the fibers go straight. And if you're sharp-eyed, you're noticing that the fibers on this do not go straight. You may be thinking, like, what is up with that? And the answer is on the back, the fibers go straight, and then they kind of wrap around, and they're oblique on the front, which is just weird. Okay, so here's their orientation. Superficially, rectus femoris, vastus lateralis on the lateral side. The IT band is going to go straight down the middle on the lateral side of the vastus lateralis. I'll show you that in a sec. Vastus medialis has this big tendon on the front, okay, and it's vastus intermedius, not medialis. Vastus intermedius, completely covered up by the rectus femoris. And then they've put here the sartorius, which also cuts across the top of the rectus femoris. And then vastus medialis goes down the medial side of the thigh. Okay, so here's what they look like on a cadaver. Okay, so that's all of them together with the sartorius there. Okay, and here the adductor muscles. Okay. All right, so here is a weightlifter where you can see these quadriceps muscles really well defined. This is the vastus lateralis. This is the rectus femoris. Notice that the belly of the rectus femoris is proximal, and the belly of the vastus lateralis and vastus medialis are distal. Okay, the main part is here at the knee. Kind of makes this little heart-shaped thing above the knee. So this is the vastus medialis. And then here's the sartorius wrapping around the knee there, okay? And on our models, on this small muscle man, you can see the rectus femoris, vastus medialis, vastus lateralis, and sartorius, okay? And then here we have the rectus femoris removed so we can see the vastus intermedius. And most of the tissue of this muscle is covered up by this tendon, but we can see the little tissue of the model up here, okay? Up here, we have, this is the iliopsoas inserting there, okay? Here is the adductor longus and the gracilis there and there. See a little bit of the adductor magnus here, and then the adductor brevis and the pectineus we can't see on this model, okay? Hope that makes sense. Here we, again on our leg model, rectus femoris, sartorius, vastus medialis, vastus lateralis, and then same on mini muscle man, where also he has really nice adductor muscles. So you can see the gracilis, the adductor longus, the adductor magnus there, okay, going underneath the sartorius. And then the vastus lateralis, you can see that the iliotibial band goes right down there. Okay, and then in the next video, it's going to be a little bit longer. We're going to go through the lower leg muscles, most of which you only need to know the function of.